My name is Kangas, and I'm a registered dental hygienist, specializing specifically in orofacial myofunctional therapy. Myofunctional therapy is essentially a series of exercises that we put together in a customized program for patients to build strength, tone, and control of the orofacial muscles.
Myofunctional therapy is a crucial part of the Function First model, particularly for children and adults 4 to 5 years and above. Whenever there is restricted oral tissue, tongue tie, lip tie, cheek ties, our body tries to naturally compensate for the lack of those movements that the muscles are not doing, and they recruit a lot of the wrong muscles in the head and neck region.
Myofunctional therapy and airway dentistry, they have to go hand in hand. The airway is the foundation and the focus of everything that I do. We are essentially working on proper tongue posture and nasal breathing and a lip seal to help support the airway.
What we've seen with research is myofunctional therapy can be beneficial for almost anybody. A lot of us have unknown poor habitual patterns in the orofacial region, and we've seen that just doing myofunctional therapy can help patients with a lot of chronic head and neck pain, TM joint pain. It can actually increase our quality of sleep just by doing myofunctional therapy, because part of the integral components of myofunctional therapy is knowing how to keep our lips closed, knowing how to breathe through our nose properly, and having a good swallow pattern.
From birth, the tongue is extremely influential in how those jaws are growing and developing. So if there's a tie, that tongue's likely going to be resting a bit lower. When that happens, we tend to see the jaws growing a bit more narrow, which affects, again, breathing in the airway. So Dr. Gandhi and I often collaborate on cases where, because of the low tongue posture due to a tie, it's affected the way that the jaws are developing. So we need to also not only release the tongue tie, but we also need to do some earlier intervention and help open those jaws. So we do some orthodontic expansion.
I won't do a procedure without an adult seeing myofunctional therapist. And that's because adults have years and years and years of compensations that we need to address prior to doing a procedure. And they are more complex medically as well. So we want to try to balance and eliminate any compensations prior to the procedure so that we can allow them to have the best outcomes.